everyone, and thank you for joining us. Today is the 6th webinar in the Center's Fall Educational Webinar Series, and we're discussing the topic of literature reviews. My name is Vanessa Pleasance, and I'm the Project Officer on our Evaluation and Research team here at the Ontario Centre of Excellence for Child and Youth Mental Health. Today's webinar has 28 people from across the province registered. Before we dive into the details about literature reviews, I'd like to go over a couple of quick housekeeping items, as well as introduce today's presenters. If you're familiar with our webinar series, you'll know that we're recording today's webinar, and it'll be archived along with PDF versions of the PowerPoint slides on the Center's website. I've emailed all participants the slides earlier this morning. We suggest logging into the audio portion using a telephone, as we found this is the best sound quality. If you have any technical difficulties, please note that I'm online throughout the webinar to assist today. So write me a question in the questions box and we'll sort out any issues together. There'll be a short evaluation survey for all attendees sent after the webinar finishes. If you could take a couple of minutes to fill out the survey to let us know your thoughts, it'd be greatly appreciated. We take all feedback into considering improving our webinars. Also, the last portion today is a question and answer period. However, Alana and Jenna are open to asking questions as we move through the material. Please feel free to submit questions at any point and I'll pass them along to them. There are two ways that you could submit a question, either electronically by using the questions box, or you could use the raise your hand function and we can unmute you so you can ask your question verbally. Your presenters today are Alana Smith with the Center's Evaluation Support Services, along with perspective from the field by Jenna Jones from Windsor Regional Children's Center. And with that being said, I'll pass it over to Alana to begin with some information about the center.
Thank you very much, Vanessa. So as Vanessa introduced myself, my name is Alana and I work at the Ontario Centre of Excellence here in Ottawa. And we are located in Ottawa, however, serve service providers throughout the child and youth mental health field across Ontario. So as you can see, we have our mission up at the front about the center. So we do bring people and knowledge together to strengthen the quality and effectiveness of mental health services for children, youth, and their families and caregivers. So this webinar series that we provide is just one example of that, including a wide range of topics, not just solely on evaluation. And as you can see, we have 3 strategic goals of learning, collaboration, and leadership. So the goals of today's webinar are to include a little bit of the background information around conducting a literature review. The webinar is really intended for those who are beginning an evaluation, but it can be applicable to anybody who is going to be conducting a literature review. The goal is really to have a better sense and a little bit more comfort with doing a literature review, including searching for literature and assessing findings, and using that literature review to gather information that's useful in designing your evaluation plan. And we'll also go over some ways you can summarize your findings to make sure that the information you do find is applied fairly easily. As well, the summary information that we'll provide will hopefully be useful for when you are actually writing your final evaluation report. So what this webinar really is not so much focused on today is that we're not really going to go over how you would conduct a full systematic review. A literature review for this purpose, for an evaluation, doesn't need to be a thoroughly, exhaustive or all-encompassing search. It's rather quite a targeted search for information that really can directly inform your evaluation. It's also not really intended to be kind of at a more graduate thesis level. Some students who have been involved with conducting a literature review have themselves been involved with research or evaluation on a very large scale, or they perhaps may be conducting or be participating in a thesis themselves. But the goals for today are really to make sure that we focus on information that can be used for an evaluation. And to this extent, it's not necessary and isn't the case necessarily for those who have received funds from the center, but a lot of the information we'll go through today will be very much applicable to those who have received funds from us. So just to summarize what I've just mentioned, that the goal for this webinar today is really to inform how we can do a very targeted literature review for an evaluation. And as an example, this is just a highlight of the recent report that was submitted from an organization within Ontario for a residential program. So what a literature review can do for you is really look at the evidence base for support of your current practice or your current program that you're hoping to evaluate. So whether that evidence is informed by literature or practitioner knowledge. It'll also help you find, hopefully, similar programs or interventions and similarities between the program that you're evaluating and what you find in the literature. And these programs may be local within Ontario or Canada, or you may find information that's useful from a much more broad base, potentially across multiple countries. And you may also, which many organizations have told us is helpful, is find measures that have been used in similar programs and similar settings, and some helpful information for how you might want to apply that within your own organization and your own program. So these are really the more essential kind of foundational reasons to look at the research literature, and it may feel a little bit daunting at times, but you should find that with some pretty careful preparation and using some basic tools that we'll share with you today, you're able to gather a wide range of information on current practices, on your particular intervention, and you will find examples of measures that have been used in other evaluations. So for those who are tuning in to us right now who have applied or are current recipients of an evaluation grant, you'll already probably have done what's found in the first bullet, and you may be focusing right now some of the points outlined in the second and third bullet. Excuse me. So just to summarize, a literature review can really help address an information need that you will have. Your literature review will also help with any evaluation questions that have been asked before, and it will help you find out what's been done in similar settings, as well as any tools, instruments, or measures that you may have used or may have been used. And it will determine, hopefully, what best practices already exist. So the essential purpose is really, as I said earlier, to inform your evaluation, and that can mean a few different things. So by answering your evaluation, by looking through the literature from as wide a perspective as possible, you should be able to find at least some information to help answer your evaluation questions. So at this point, I would just like to pause and have our co-presenter, Jenna, introduce herself a little bit more and describe briefly how she got involved with Windsor Regional Children's Center and her role within the evaluation.
Hello, everyone. My name is Jenna Jones, and as was mentioned before, I'm a master's level student at the University of Windsor, and I'm doing a degree in child clinical psychology. So I've been involved with an evaluation grant that the Regional Children's Center has, and they're using that grant to evaluate their PPP group programs in the community and at their clinic. So I became involved with the grant because one of the psychologists at RCC, his old research supervisor is my current supervisor. She's a professor at the University of Windsor. So we asked her to collaborate with them on the grant, and me being her student, I was asked to be involved with the grant as well. So I've been involved for about a year now. I came to meetings where we worked on the logic model and determining what questions we wanted to ask. I'm using this data as part of my master's thesis, so I'm very, very happy to have this opportunity to use some clinical data for my research. And so what I've done is I've helped with things along the way. We had a hired research assistant input the data for us, and then I analyzed the data using SPSS computer program for them, and I also helped them with the literature review. So that's basically what my role has been with them, and I'd be happy to answer any questions at the end.
Great, thanks so much, Jenna. And Jenna will have the opportunity to provide a little bit more of her perspective a little bit later on within the webinar today. Great, thank you. So in terms of where to begin, this can feel, as I said a little bit earlier, a little bit daunting and can feel a little bit of a tricky issue for many agencies. And it might feel particularly daunting if you're a bit of a smaller agency where often staff people may wear kind of multiple hats within the organization, or it may have been a little bit since you've looked at the literature. So not to worry, accessing academic research databases, yes, usually does, in the past has often required having some form of a paid access, and it can be very expensive for individual journals. And so what's happened in the past, or what we've often seen in the past, is that many agencies have gained access by having potentially local college and university students on an evaluation team, while some might have had access through their own research department, or maybe a local affiliation with a university or a hospital. But the good news is that increasingly we are finding that there are several options that can get you started where there is very open access and quite a few options to start your search. So we will go over a few of those later on throughout the webinar. So some things to think about before you get started are really what are the goals of your literature review, as well as who is going to be your audience and what are the important messages. So, planning at this point really pertains to how your written review is going to be used and by who. So the wording as well as your organization should fit within the priorities and context of the audience, which in your case would probably be your evaluation team, anybody that's interested within your staff at your organization, to a certain extent us at the center as well, and anyone else who is going to be interested in your program evaluation. So a lot of what I'm going to say today is actually able to be found within that link that you see at the bottom of the screen. So please, after the webinar, look at that, some of that information that you will find, and I'll just go over some of the more of the highlights right now. We'll also be sending out a supplementary document that has a little bit more of this explained in detail. So if you click on that link, you'll see some links to some resources such as our measures database, which I know has been discussed in the past on some webinars. So as you probably are aware, it's an online repository of, I believe, over 400 measures related to child and youth mental health. Through that link, you can also find our Grants and Awards Index, which I'll talk about a little bit later, as well as some of our archived webinars and upcoming webinars. On that link, you will also find a further link to the Canadian Evaluation Society, which contains a searchable database where you should be able to find quite a significant amount of information. I know us at the center, we use that periodically for our own purposes as well. And there's also a link to the American Evaluation Association, and they have a number of links to online resources. So I thought we would start talking a little bit about probably the most straightforward and simplest way to search for information, especially related to your evaluation, and that is through Google Scholar. So we've heard several times from organizations say, is it okay to be using that? Is that legitimate? Is that going to find, comprehensive information? And the answer is definitely a resounding yes. The Google Scholar is probably from our perspective, one of the most easiest places to begin, and it is actually very effective. But just to note, this is not a general Google search. You do have to go within Google, within the section of Google Scholar. So we've highlighted just 2 articles on the screen there where there were 2 separate investigations into exactly whether Google Scholar is kind of a sufficient mode of searching for relevant articles and systematic reviews. And so we've just taken out and highlighted the conclusions from both of those articles. So I don't need to read them in full for you, but just to summarize that the answer was yes for both of those both of those questions, that it is most certainly an effective and beneficial way to search for articles. So I'd really recommend you take a look at both of those articles. I found them really encouraging myself for just knowing that you're accessing a comprehensive amount of information. We'd also like to highlight just 4 different databases as well that you can visit in order to do your search. So we're finding more and more that articles are increasingly becoming quite freely available and not behind any paywalls. So what's nice about Google Scholar that I should have mentioned is that it does point you right at a PDF or an HTML version of an article. That these 4 sources here all have free content. And Pubmed Central, I will just note at the bottom, is where you can get open access primary research articles. And this can be especially useful for evaluation because they tend to have some of the best examples of measures specifically and similar studies to what you're probably, or similar evaluations, I should say, to what you're conducting. But all 4 of those are worth visiting. The next one here contains just a couple more links. These are online databases which are not fully 100% but do have some limited free content. So just to note that PubMed and Pubmed Central are different, as was mentioned on the previous slide. Pubmed Central is a repository of 100% freely accessible articles. PubMed and PsycInfo are really common search sources for mental health research, though, so they are still worth visiting for at least some limited free content. And a final one I'd just like to take note of here is the Safeguards Training Virtual Library. So many of you are probably familiar with Safeguards as a training organization here in Ontario. So this is a very low-fee kind of way to access databases if you don't have, that student access that I talked about earlier or other means of access. So Safeguards has joined forces with the Woodstock General Hospital, and they're now part of the Western Ontario Health Knowledge Network. So this virtual library provides access to relevant evidence-based journals, databases, and information, as well as a professional research librarian to assist you. So some of the specifics is that it does cost $450 plus HST per subscriber. But those who do subscribe get that database access, and the research librarian would be especially helpful. They're available to conduct intro sessions for agencies that want to learn more, and we've been told that they have a recorded webinar that just gives a bit more of a description about their services. So if you visit their website, you should be able to find that there. If you have trouble, please get back in touch with us, and we'll hopefully point you in the right direction. And if you're specifically interested in this Safeguards Training Virtual Library, just get in touch with us because we have a couple specific names of individuals that we can put you in touch with directly. So we're going to next talk a little bit more specifically about how to search, and Jen is going to give us a little bit more specific information around that, as well as some of her experiences.
Okay, hi everyone again. So the first thing we're going to talk about is some different areas to consider when you are doing your lit search. So the first one is the population. So you'd really want to make sure that you're searching for content that would be similar to the population that you're serving. So usually you would look for things like age, whether you're looking at a specific age group of children or teenagers or adults, gender, ethnicity, and similar to that, different countries. So maybe it might be the case that research conducted in Australia or Hong Kong may not apply to people in Canada. Also looking at specific diagnoses, whether the participants have clinical levels of different mental health issues or not. And there could be other characteristics you're looking at as well. You're also going to want to look at the specific intervention. So if you're looking at a specific type of therapy or a specific program, for example, Triple T, which is what I research, you're going to want to look for the same thing that you're studying. That's what is going to be the most relevant. And specifically to Triple P, if anyone else is looking at that, you're going to want to consider the different levels and modalities that it's offered in. And also the outcome. So You might find that some programs are effective in changing a child's behavior or maybe parenting skills, but you'd want to make sure that the outcome that you're looking for in your population would be similar to the research that you're talking about and looking for as well. And some of this is covered when you're creating your logic model, so you can refer back to that when you're looking specifically at the outcomes that you'd like to evaluate. Okay. So now I'm just going to give you some practical ways that you can, and tips for searching a database. So first you'd want to think of your keywords as what you're going to search. So usually if you're looking at evaluating a specific program like Triple P or Incredible Years, that would probably be the first search term you'd want to use. And you'd probably need to narrow it down, because if you just search something really broad like that, you're going to get a ton of hits that you don't really want that many. So you can use restrictions to refine your search. So you could look at just in children or just in Canada or just of families of low socioeconomic status or something like that. You can also select searches by author or within a particular journal to narrow it down as well. Another tip is you can keep track of keywords and terms. Some people would keep track of their searches in a Word document, which can help you to make sure that you're not missing anything or that you're not duplicating your work. Some tips for online searching just in general. You can use the specifiers of and, or the little asterisk. So for example, if you're searching for children and anxiety, it'll only pull those articles that have both of those key terms in it. Similarly, if you want to use the or specifier, you could search for developmental disability or intellectual disability, and it would give you articles that have either one of those terms if they're used interchangeably. And if you use the asterisk, an example would be if you're using the word child with a star on the end, then it will search for things that have the word child, children, childhood, things like that in it. So that's another good search for limiting or expanding your data search. So some examples of getting started. For my research, if I was looking at Triple P, I'd probably look for some other key terms such as parenting, behavior, children, meta-analysis. I'd probably look at Google Scholar. In my field, I tend to use PsycInfo for pretty much everything, but I have access through the university, so that may not be possible for some people. You can also set limits of things to be English language only, peer-reviewed. You can set a limit for a year. One thing I'd like to say about the year, typically 5 to 10 years in the past is the most recent and considered to be the gold standard for articles. But if you're researching a program that was, say, developed in 1995, if you're limiting it to 2003 to 2013, you might not get the original article that presents the program. So you might need to not limit the years for certain parts of your searches. So an example of a search in Pubmed Central. So this is just a screenshot of searching for Triple P and meta-analysis. And this is limited from 2005 to 2013. So you can see, you can put in the different fields, and you can also, where the little arrow says all fields, you can change that to be specific to the title or abstract or the journal if you're looking for something more specific. And you can also see the specifiers on the left that say and. You can usually change that to or to not, and that can help you as well. So this is just a screenshot of what the articles would pull up for you. So then this came up with 49 hits. So you could start looking through some of those, and some of them might not be relevant if you have, they might just happen to have the right words, but they may not actually be relevant. So you can search through those to find the articles. And usually if you just click on where it says PDF there, then it'll just pop up the article for you. And you'll find something similar for Google Scholar and for PsycInfo as well. So here's another example of an article. So the question that you're trying to answer in this example would be, how do I navigate resources to better access and use research evidence in my practice? So in this article, it focuses on one of the key skills of the evidence-based practice process, which is finding the best available evidence to answer a clinical question. So this is a list of the type of studies that you might come across in your literature search. These are explained in a supplementary document, so I'm not going to go through each one, but I will give you just a brief description of some of them. You will find original research, though. The people who actually collected the data and analyzed it, comparing two groups, or maybe looking at how effective an intervention is. You might also find systematic reviews, which would just be an author summarizing results found from a bunch of other people who have published their work. And a meta-analysis is when they would combine the results using a statistical analysis from a bunch of different studies that have been conducted. Those are the main ones you'll find. So this part is reviewing, evaluating different types of research and how the type of quality they are. So as I mentioned before, a primary source would be the original publication of new data, results, and theories. So these are the people who actually did the research and they're presenting their findings. A secondary source would be like a literature review or meta-analysis, and they are generally summarizing or commenting on different primary sources. So they aren't the ones who physically went out and gathered data and did the research. What we call gray information, it would be things that are informally published, such as reports or websites. It can be useful, but primary and secondary sources that are published in peer-reviewed journals, those have gone through different professionals in the field. Usually probably 3 people have seen it before it's published, so you have more, it has more credibility for that. Okay, so here's some other strategies that I thought might be helpful. Just going in and providing a search won't find everything that you need, so there's a few other strategies that could be helpful. The first is to look at the reference pages of other articles. So pretty much any article you're going to find that's a primary source will have already done a literature review, and it's probably going to pull a lot of the sources that would be really useful for you. So you can look at their reference page and look at their sources, and you can pull out the ones that you think might be relevant, and then you could search the title in Google Scholar or PubMed or whatever you're using and try and find those articles. And I recommend that you actually go and read the article or try and get your hands on it instead of just citing something that someone else cited. Another handy tool is the As Cited By button on Google Scholar, and you can see the second screenshot there. On the bottom left, it says cited by 636. So if you click on that, it'll show you all of the articles that have cited the study. So that's another good way to find more articles that could be useful. Another thing, especially with Triple P, programs love to brag about their research backing. So if you go to the Triple P website, for an example, or maybe other programs as well, some of them will have a section about their research findings, and they'll provide a list of references or, in some cases, even articles. So for example, if any of you are researching Triple P, they offer a huge database of published articles that you can access for free. So you can use the website as well. But you'd want to make sure that you're looking for the peer-reviewed research articles and not just relying on what the website says, because obviously it will be biased. And my last tip, which may not be practical for everyone, but I have to go on a rant about this, get a student. It has been, my experience with working with the staff at RCC has been mutually beneficial for all of us. I've been able to access data from a clinical sample that is really difficult to do. And so I've really enjoyed being able to use that data and to be able to make some connections with staff at RCC. And it's been really helpful for them as well, because for my thesis, I had to do a lit review anyways. So I basically did it for them to some degree. I gave them showed them a lot of what I had done, and then helped with writing the grant report, which was submitted last month. And I also helped them with developing questions and analyze their data for them, all for free. So if you have any opportunity to get a student from a local psychology department, then I'm sure they would love to hear from you. Okay, so I'll hand it over to Ilana for this part again.
Great, thank you so much, Jenna. And I will, you're being very modest as well, I think, though, because I know you have spent significant amounts of time working with those on the evaluation team within that organization and passing on, all of your strategies and ways that you were able to do a lot of this work for them so that it can continue once, inevitably you're no longer most likely going to be involved with Windsor Regional Children's Center. So I don't want you to be too modest in the way that you've done, all of this work and they are not able to, continue it on afterwards. You've spent a lot of time, I know, working with the rest of the evaluation team. So you should have some kudos sent out to you for that too.
Thank you.
So we're going to go on now to the stage in your literature review where you're going to assess all of your findings. So you may at this point have a huge stack of articles saved on your hard drive or printed out and it's laying on your desk. And so this is the stage where you want to look at each one of those to determine the quality and usefulness of the actual work that went into the article and how you might be able to use that in your own work. So these are just some of the considerations you'll want to keep in mind when reviewing articles. None of us here at the center, are full-time methodologists or full-time scientists, and I know that's, most times not the case for yourselves as well tuning in. So in a certain sense, we do have to hope that the methods were reviewed appropriately for each of the articles that you review, and that's a major reason why we like to rely on a peer-reviewed article, as Jenna was mentioning, rather than an informal, website publication. And for your purposes, you can try to focus on whether the article seemed relevant to your evaluation without worrying so much about, analyzing all of the intricacies of a methodology. And your supplementary document that will be sent out to you does have more information on how to assess. So we're going to now look at, with your various articles, assess and organize how you're going to assemble them. So to try to bring all of that information into one document, it's really recommended, and what other agencies have advised that they've done, is created what we called a summary table. So this can look like a number of different things, and it has a number of different headings in it, but most of them do contain the following headings that are just kind of a snapshot that you see there, and I'll mention a few others. So this is kind of an early summary document that acts a bit like an outline, and this can be really done just easily in Word and populated one row at a time for each article. So it takes your large stack of articles and trims it down to a bit more of a manageable table, and it will help you focus your findings from the lit review and help to kind of group certain ideas and conclusions together. So there are other potential columns that you might want to include. So such things as your study population characteristics. Age is obviously a very important one, since you most likely want to focus on children and youth, unless there's a parenting component as well potentially, or an adult component to your program. Gender may be a particular identifier that you want to highlight. Other setting characteristics, such as if it was done in a community clinic or a hospital, a school setting, that is most likely going to be a relevant aspect of your search, as well as potential limitations of the article. Most articles will be pretty clear about what some of the limitations are that they encountered. And you also may want to include a column on why the study is relevant to your own work, so that it helps clearly summarize the key findings and how you might want to use them. So in terms of summarizing the evidence, you want to ask yourself some of these questions that we've outlined here. And if you use an annotated bibliography to write up your summary of each useful article, these points can really be written down explicitly, so that it's easier to compare and pull out what's the most important and useful information when you go to actually write your full literature review. And we really want to make sure that we highlight some of the issues that people will identify in their articles around limitations and gaps, because often what we've seen is there's so much really, really good work being done in Ontario, and by sharing findings amongst each other, whether it's through the center and we are able to be that dissemination point, it really is helpful to the entire child and youth mental health field. And our Grants and Awards Index, which I'll talk about next, has several completed evaluation reports from other agencies. So this is just a snapshot of our Grants and Awards Index, and it's one of the first places I would look if I were investigating and I was conducting an evaluation myself, because it is a summary. It has a summary of existing evaluations that have been conducted by agencies who have worked with the center in some capacity, and it will just include some information for how they approach their evaluation, as well as their literature review themselves. So you can search the Grants and Awards Index. You can search by keywords, an organization, the year. You can also search by the sector, so whether you want to specifically look at literature that's been, or an evaluation that's been done perhaps in the youth justice system, perhaps the addictions sector, or you can also search by a region. So I would definitely go through here and you can search in a variety of different capacities. If you're not finding exactly what you're looking for, though, please feel free just to get in touch with one of us here at the center. So for those who have tuned in who are receiving support from the Center for their evaluation, I'd really like you to keep in mind that the literature review portion of your final report is, and you would have received these specifications earlier, but just to highlight, the literature review portion is a 3 to 5 page introduction that really just includes the highlights from your lit review. And so you can submit and include your full literature review as an appendix if it does go beyond the 3 to 5 pages. And these are just some more of the specifications for how to physically write up your lit review, but please note that it doesn't have to be a really daunting, really extensive, lengthy report. So I'm just going to turn the next slide over to Jenna just to give a few tips for writing the literature review.
Okay, so these are just some general tips for when you're writing the literature review. A common error in scientific writing is describing each study that you've read one after the other. So just saying, this study found this study found this. It's really boring to read and difficult to interpret, so try to avoid doing that whenever possible. As the writer, you should be integrating relevant findings together instead of making the reader do that work. You should also limit the description of the method of other studies that you include. You might want to say something like, there's a lot of evidence that this program is effective in improving parenting skills among lower SES populations. And then in brackets, you'd have the sources. So you'd want to really group similar studies and findings together instead of just listing them one by one. And you'd want to really just focus on the main findings from each study instead of just every single tiny detail from each study. Usually when you're writing a literature review, it's best to start off with the most broad general findings. So you might start with how the program was developed, research supporting its general effectiveness. Then you'd move to things more specific, such as what populations the program is effective in, maybe really specific outcomes that you're looking for. So you'd start broad and move to specifics, kind of like a funnel metaphor we use for that. And the easier it is to read your literature review, the better. Avoid using flowery language. Present the information in a simple form. Use the most clear, concise language possible. That'll just make it a lot easier for people to read that. So I'll hand it back to Alana for the next slide.
Thanks so much, Jenna. So we're just going to wrap up with a few next steps before completing our webinar today and opening it up for any questions that people might have. So some of your next steps, once you've conducted your literature review, are really to refine and potentially expand your evaluation questions. So based on what you've gathered, it may have prompted, another couple questions. It may have helped you make your evaluation questions a little bit more specific. So taking another look at that to seeing if you want to make any changes. Some other additional next steps are going to be selecting measures. So based on your literature review, you most likely would have found some helpful tips for potential measures you may want to include. It doesn't mean you're necessarily bringing in any additional measures, but that may be the case depending on what you're evaluating. You will also most likely want to do some more work on your evaluation framework and fine-tune it, bringing that back to the evaluation team just to make sure it's as complete and concise and thorough as possible with everybody's input as much as possible. And some additional next steps, not to plug the center too many times, but we would love for you to participate in the upcoming webinars that we do have as we try to follow your evaluation journey with additional webinars. So just a few other additional resources at the center are our Evidence Insight report. So some of you may have accessed that Evidence Insight link on our website before. But if you haven't, it's really worth visiting because we have an extensive number of reports outlined there. Not all of them are able, you're not able to click on all of them and download them, but we're very much happy to share any of them that you may be interested in. So they're organized under 3 broad categories of mental health concerns and interventions, community level practices, as well as organizational practices. So if you click within those links, you'll see a whole list of a number of different subject areas where people have asked us a question in the past and asked us to look at some of the literature around a certain topic. And we're more than happy and would love to share those with as many people as possible. So please get in touch with us if you'd like any of those shared with you. And as I mentioned already, visiting the Grants and Awards Index will be a really helpful place to start, particularly because those contain information and background information and reports specifically on evaluations.
So that brings us to the question portion of the webinar. Thanks so much, Alana and Jenna. And since it's about 1:41, we do have lots of time for questions. So there are 2 different ways that you can submit your question. You can type it in the questions box, and then I can read it out for you. Or you could raise your hand and we can unmute you so you can ask your question to Alana or Jenna directly. We'll give you a couple of minutes to get typing or put up your hand.
And while questions are coming in, I will just share one question that we've had several times from a few different agencies, so it might be worth repeating here. We've been asked a few times in the past how often you should conduct a literature review for a program that has already been successfully implemented. So in the past, you may have done a lit review and you've gone through the full evaluation process, and you may be in more of a kind of sustaining phase for your evaluation. So, and again, there's not really a hard and fast rule to answer that question, but what we would suggest is periodically going back, you know, at a minimum about once, roughly at a minimum once every year or so. You will find that certain areas will have a significant amount of information get evaluated or researched on that really does provide a lot more information and advances a certain field quite a bit, whereas other times there may not be a significant amount of information that gets updated. So it doesn't have to be a lot of work, and it doesn't have to mean a lot of time on your end, but it is worth really kind of delving back into the literature about once every year or so.
Wonderful. While we wait, also we'll just pull up Alana's contact information for you.
And while we're waiting, I will perhaps just go over one other question. And please don't be shy about asking a question. Chances are, if you're thinking it, somebody else is as well. So if a question does come in afterwards, by all means, email either myself or Jenna, whoever you feel is most appropriate. But please feel free to bring up any questions that you have right now. But I'll just mention one other question that we have had come up a few times, and that is, how do you know when you've gathered enough literature? Or another way that some people ask is, how many articles are sufficient to really feel like you've done an exhaustive search. So I'm not sure if Jenna, you have any, I don't want to put you on the spot, but I don't know if you have any comments that you'd like to give around that. But what I would suggest is you know when you've gathered enough literature, when you start really seeing a lot of trends or start seeing a lot of repeat information, if some articles that popped up that really resonated for you start popping up more and more as you search, it probably means that you've maybe not exhausted the literature, but you've kind of done a really good broad base. So I don't want to bring up anyone's fears of needing to have X number of articles searched that you may have had to encounter in school, as I recall having had to do. So don't worry about needing to do X number per se. It really depends on what you're evaluating and researching. So Jenna, did you have any other comments you wanted to say around that?
Usually when I'm asked to write a paper for a class, usually it's around 10 articles, and those are usually longer than 3 to 5 pages. So if you want a number, maybe 10, but more is better. And you don't have to read every single one, because after you've read one of their lit reviews, usually it'll be the same information, so you can kind of skim and just pull out the main findings. So you don't have to physically read every single word of every single article.
And a question came in wondering, so it's almost the same question, but it was just wondering whether there's a minimum of primary versus secondary sources that are recommended.
That's a good question. Offhand, there really isn't a number offhand that we have in terms of recommendations for that. There may be to satisfy other reports or other endeavors you might be involved with. In terms of evaluations that we are involved with at the center and what you might be involved with, I'd say try to focus as much as possible on the primary, but if what you're finding that comes up a lot more is the secondary, then that's just as legitimate information to be including. So kind of ideal situation, you have some from the primary, but I hesitate to really narrow it down to a certain number per se. I would just focus on the primary first and then move to secondary.
Yeah, I would say probably you'd want a mix of both. In terms of reading, it's probably easier to read a literature review first to get a general picture, and then go and physically read some of the articles that are primary, but you'd want to make sure you have at least a few of the primary ones as well.
Great, thanks, Jenna.
And just to highlight the upcoming webinars, we have one that's not listed here, but we have a webinar on sustainability coming up next Wednesday, November 27th, and that's the sustainability of an implementation. And then we also have performance measurement, the second section of this, on January 21st, and also selecting indicators and measures on February 4th. And as always, we have the evaluation, which will be kicked into your email box once you click that you exit the webinar. So if you could take a couple of minutes to fill it out, that would be great. And if we don't have any other questions, thanks very much to Jennifer co-presenting and Alana as well. And hope everybody has a great afternoon.
Thank you.
Thanks.